Persistent sleepiness on CPAP. Let's consider a scenario. Patient has been on CPAP for the last 30 days following a home sleep study, and the patient returns complaining of persistent daytime sleepiness despite their claim that they're using the CPAP machine daily. Now, the first thing you want to do is get the download data. The download data will show you what the AHI is. The AHI is the apnea-hypopnea index, which is a measure of severity of their sleep apnea. Ideally, you want it to be less than 5. However, there are some patients that may not respond well to CPAP due to mask leak, for example, and require change in mask. As this occurs especially in patients who are mouth breathers that use nasal masks initially. Another issue that may develop that may cause the AHI to go up is the conversion of obstructive sleep apnea to central sleep apnea, which is called complex apnea. Most patients take about a few weeks to months to acclimatize to this. However, there may be some patients who require repeat in-lab study to assess for this. The other issue is time. Now, usually most patients will attest to the fact that they're using the CPAP machine appropriately. However, when looking at the download information, you'll find that many patients are underutilizing it. It's important to use it at least 4 hours a day and at least 70% of the time, which is an insurance requirement, and most of the initial basic CPAP studies were done on using this criteria. However, it's important that the patients use it as long as possible and more often than possible, as possible. The next thing is to look at is the duration. Now, the duration, as I mentioned before, above 4 hours and more than 70% of the time, which is roughly equivalent to more than 2/3 of the month. But this is actually has to do more than just the total amount of time that they're on it, but also the continuity on it as well. As fragmented sleep patients who wake up sometimes, stop using the CPAP and go back to sleep without the CPAP. Some patients wake up to use the restroom and so on, may contribute to the daytime sleepiness as they don't get continuous sleep. Some patients may only end up using it for a few hours during the night and end up using it during a nap in the afternoon. Hence, the total number of hours may be more than 4, but there's no continuity of sleep. The longer the continuity of sleep, the better and more restful their sleep is, allowing them to get into REM cycles and so on. The next thing to consider is medications. Now, what's important to look at medications is not only the sedatives that the patient may be on, but also the stimulants. Now, most of the sedatives that we consider are like benzodiazepines, and these are the common culprits. However, anti-epileptic drugs are also another common culprit, and also painkillers. And some of these need to be evaluated as they can cause or contribute to daytime sleepiness. Though the CPAP machine may be helping with the obstructive sleep apnea, the persistent sleepiness may be due to the sedatives. Stimulants can disrupt sleep, causing them to be fragmented, and hence resulting in patients not having restful, continuous sleep during the night. And this can be due to SSRIs, nicotine use, alcohol use, and so on, even caffeine use. So these are some of the sleep hygiene issues that need to be considered. Some stimulants may also worsen some other sleep behavior disorders such as periodic limb movement and so on, which may fragment sleep. And the next step, if you have no success thus far, is to consider repeat an in-lab study. Now, if most patients nowadays are getting home sleep studies, it may miss out on other sleep behaviors that occur at night, and for example, periodic limb movements of sleep, central sleep apneas, and so on. A consideration is to referral to a sleep specialist to consider other possible causes of persistent sleepiness, such as idiopathic hypersomnia or some of the other hypersomnia issues such as narcolepsy. The other thing is nocturnal seizures, periodic limb movements of sleep, other behavioral abnormalities during the sleep can also cause persistent sleepiness. And the third thing, if the patient has not responded at all to any of these evaluations, is to consider a stimulant. Now, a stimulant that's FDA approved is modafinil, and that should be considered in a minority of patients who are on CPAP, and despite being on CPAP, continue to have persistent daytime sleepiness. Thank you.